Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Let me briefly introduce myself. My name is Agna Silmi Kamil Azhar. I'm from Blood-Bank Technology Health Polytechnic of Semarang. Today I'm here to talk to you about neutrophils and oncology. Before we talk about that, I will give you some general information that neutrophils is a type of white blood cells. The fact is, white blood cells are not actually white. And now I will present to you about neutrophils. Does anyone know about neutrophil? Neutrophil is a type of white blood cells. In fact, the most of the white blood cells that lead the immune system response are neutrophils. There are 4 other types of white blood cells. Neutrophils are the most plentiful type, making up 55 to 70% of your white blood cells. White blood cells, also called leukocytes, are key part of your immune system. Your immune system is made up of tissues, organs, and cells. As part of this complex system, white blood cells patrol your bloodstream and lymphatic system. When you're sick or have a minor injury, substances that your body sees as foreign, known as antigens, call your immune system into action. And now we move to the next. Things that cause the hike of neutrophils. Having a high percentage of neutrophils is called neutrophilia. This is a sign that your body has an infection. Several factors cause high neutrophils. There are infection, injury, surgery, smoking, high stress level, heart attacks, and chronic myeloid leukemia. And the next one is things that cause the low of neutrophils. Neutropenia is the term for low neutrophil levels. Low neutrophil counts are most often associated with medication, but they also can be a sign of other factors or illness, including bone marrow failure, aplastic anemia, febrile neutropenia, which is a medical emergency, congenital disorders such as Cosman syndrome, cyclic neutropenia, hepatitis A, B, or C, HIV/AIDS, sepsis, and leukemia. And that's it for this part about neutrophils. I like to move on to the next part, which is about oncology. What is oncology? Oncology is the study of cancer. An oncologist is a doctor who treats cancer, provides medical care for a person diagnosed with cancer. The field of oncology has 3 major areas: medical, surgical, and radiation. A medical oncologist treats cancer using a chemotherapy or other medication such as targeted therapy or immunotherapy. A surgical oncologist removes the tumor and nearby tissue during surgery. A radiation oncologist treats cancer using radiation. And other types of oncology include gynecologic oncologist treats gynecologic cancers such as uterine, ovarian, and cervical cancers. A pediatric oncologist treats cancer in children. Some types of cancer occur most often in children and teenagers. This includes certain brain tumors, leukemia, and osteosarcoma. A hematologist oncologist diagnoses and treats blood cancers such as leukemia, lymphoma, and myeloma. The next one is the role of the oncology. An oncologist manages a patient's care throughout the course of the disease. This starts with the diagnosis include explaining the cancer diagnosis and stage, talking about all treatment options and his or her preferred choice, delivering quality and compassionate care, and helping a patient manage the symptoms and side effects of cancer and cancer treatment. And that's all for me. Uh, if you have any question, you can type your question in the comment below. Thanks for your attention. Wassalamualaikum warahmatullahi wabarakatuh.